Everyone, I'm Laura Barrett. My presentation is about narrative therapy, which is a postmodern approach. The history of narrative therapy begins in the 1980s, and it was founded by Michael White and David Epstein. They were influenced by postmodernist thinkers Gregory Bateson, who said reality is subjective, Edward Bruner, who said identity is constructed, and Michael Foucault, who said societal rules can be confining. The core concepts of narrative therapy are that the person is not the problem is the problem. In other words, people live by stories, and sometimes they internalize at a young age stories that become problematic for them when they are developing their own identity later in life. These dominant stories that they've internalized can be limiting. Therefore, in therapy, change occurs by externalizing those limiting narratives or those problems, deconstructing them by figuring out where they came from and how they're limiting the client's life. And finally, reauthoring new alternative narratives or stories that allow the client to be truer to their current values and their current identity. The counseling relationship in narrative therapy involves collaboration. The client is the expert of their own stories, and the therapist's job is to listen to them and listen for their authentic values and hopes by asking questions to help them unpack those stories, some of which are going to be more authentic to who they want to be. Once the client is able to separate the stories that represent them and their current identity and the stories that they've internalized that no longer serve them, they can begin to reauthor a new narrative for themselves that uses new language to describe who they are. Populations that are well suited to narrative therapy are populations that have experienced stigmatization or marginalization in some way. And that encompasses a lot of different kinds of populations. Individuals with depression, anxiety, grief, trauma, or eating disorders, or children and adolescents. And as I said, marginalized groups or couples and families. So I cited 3 different studies that show people from these different populations having success using narrative therapy. The first one by Jorgensen et al. Used narrative therapy to help children in situations where they were experiencing the feeling of being powerless. And the narrative therapy was gave them the ability to reauthor their narratives and see themselves as having more control and more power in their situations. Conti et al. Used narrative therapy to help people with eating disorders, and they discovered that separating people from their body dysmorphia and helping them realize that that view of themselves is not part of who they are, but more rooted in troublesome narratives that they'd learned and internalized. They were able to allow that part of themselves to take more control and to stop themselves from seeing themselves in a disjuncted or separated way. Finally, Edamade Charda et al. Used group therapy to help Iranian women whose husbands were either having troubles with substance abuse or addictions. And these women were struggling with holding up many, many household duties, along with the troubles of their husband's addictions. But together in this group, they were able to support each other, not only in seeing themselves as powerful determinants of their situations, but also as support for each other. Narrative therapy in action goes in stages. The first is, as I've said, to externalize the problem and see it as something separate from the individual. Once the individual can see it as separate, then they can, through the therapist's deconstructive questioning, begin to discern where these troublesome narratives came from and how they affect their life. In addition, the therapist helps the client to see times when they have had authentic expressions of who they want to be, who they're the more powerful version of themselves. Finally, the client is helped with reauthoring a new narrative for themselves with new language and new, more empowering symbols. Finally, once the client begins to live according to their new narrative, witnessing their change is very powerful in motivating them to continue operating within this new narrative. They can have, the therapist can witness this change by documenting it in writing or having people in the client's life visually tell them the changes that they have noticed. Here's a sample dialogue of a client therapist discussion. It is definitely condensed, and this type of realization would probably take place over several therapy sessions. But the client says, I've just always been an anxious person. I overthink everything and it makes me feel stuck. The therapist replies, let's look at anxiety as someone outside of you trying to take over. What would you call it if it were a character? Maybe the doubter. It always makes me question myself. That's a powerful name. So when the doubter shows up, what areas of your life does it mess with the most? And the client says, mostly at work. It makes me second guess my emails, freeze in my meetings. It makes me feel like I'm not good enough. The therapist replies, yet last week you told me you led a part of a team meeting. It doesn't seem like the doubter was in charge then. The client replies, yeah, I did. I felt nervous, but I also remembered how prepared I was. I guess I showed up as a leader that day. Therapist replies, I love it. The leader. What would a story about you as the leader sound like? It would be about someone who still feels doubt but leads anyway. Someone who's starting to trust themselves. Therapist replies, may I write you a letter reflecting your leader story so you can return to it when the doubter tries to take over? Yeah, I'd like that. It's easier to believe when I hear it from someone else, too. So you can see that the therapist is helping them to externalize the inner dialogue or the inner critic or the doubter, and also externalize or internalize, I should say, the leader or the person who is more comfortable being confident and in charge. What neuroscience says about narrative therapy is that when narrative therapy is done in a more cognitive way. It is less effective than when it is done in a way that activates emotions for the client. So these three studies show that when the default mode network is activated by emotional responses, clients are able to light up many areas of their brain, which makes the situation remain more concretely seated in their memory. So, for example, if a client were having a lot of emotional reactions to their limiting narrative, they might feel guilt or they might feel shame. If the therapist draws attention or brings up these emotions for the client when examining their limiting narratives, they're more likely to understand and internalize the limiting effects and of these narratives that they have unconsciously taken in. Whereas if they also experience emotions when they are examining their authentic life narrative, that also is going to make it more strongly rooted in their memory and more strongly rooted in the identity that they would like to become. So therefore, the empty chair technique is it's a Gestalt technique, but it's really a good technique to use in narrative therapy. The difference between Gestalt and narrative, though, is that the empty chair technique is used to create a new narrative or a new life story, whereas in Gestalt therapy, it's used for catharsis or emotional release. At any rate, I think that the empty chair technique is good because it makes it more likely that the client will be able to experience the emotions around their inner dialogue or their inner stories. So if they speak to their inner critic or from the perspective of their inner critic with the pronoun you or I, it brings it to the present and it makes it as if you are speaking directly to that frustrating dialogue that blocks you. If you're speaking directly to it as a person, it brings up those emotions and makes it more likely that you're going to understand how this has played out in your life, and vice versa, bringing up the emotions around your inner leader or whatever your empowered life story may be. It also makes it more likely and more strongly rooted. So let's look at the cons and pros of narrative therapy. The cons are that it's less structured and not ideal for crisis. It requires a level of verbal ability that may not be easy to access with maybe second language learners or children, and it may lack immediate symptom relief. On the other side of the coin, it is a non-pathologizing method that is strengths-based and client-centered, and therefore very culturally sensitive. It allows the client to author their own story according to their own situation. Thank you for listening to my presentation. These are my references. Thank you for listening, and I hope everyone has a great day or evening.